Well, after 5 seconds of looking at your eye with a smartphone, Brightlamp's machine learning algorithm can tell whether you've sustained serious head trauma. And now the Purdue University graduates behind the patented Reflex app have made it far more mobile. On the Innovators with Dr. K this month, we learned how it is now able to detect other things like Alzheimer's. Dr. K, take it away.
Well, thank you, Gary. This truly is a breakthrough innovation in the healthcare space. So I'm very pleased and proud to have Noel Paul, the Chief Commercialization Officer of Brightlamp, with us today to explain some things for us. So, Noel, welcome to the show.
Thanks, Dr. K. Glad to be here.
I always start off with, what exactly was the genesis of this idea?
So one of our founders, Curtis Sluice, a Purdue chemical engineer, was really working on novel disease detection methods. Okay. And he was hearing about the concussion crisis and felt like he could bring technology to the issue and help use technology to diagnose and treat recovery concussions.
Gotcha. So what exactly is Brightlamp as a company?
So research has shown that the pupil is the window to the brain, right. And Brightlamp's goal is we're a healthcare technology company that's focused on really unlocking the diagnostic power of the pupil.
Okay. So please explain to the audience, what's the specific innovation breakthrough that you've really developed here?
Sure. So the current method to kind of check the pupil response to light is either a subjective test. You know, when you go into the doctor's office, they'll shine a light. It's a very subjective view. On the other side of the spectrum, there are these very costly devices that are very limited use because they're not mobile and they're very expensive and require additional hardware. Well, we've been able to put the ability to assess the pupil in a quantitative way on a mobile phone, so now it can be the hands of multiple healthcare professionals.
Well, that's fantastic.
Yeah, so a couple things we've improved on over the last few months is really twofold. One, we've actually compared our technology to the current standard of care, and we found that our readings are much more consistent, less variability, which means that the readings are going to be more reliable. And the second thing we've been able to do is now be able to provide healthcare professionals a comparison of the patient's results to what normal healthy people should be doing. So it's almost like a lab results where the results will be read if they're outside those normal ranges. So that will help them make better decisions.
Boy, that's fantastic. What's the potential market for this?
Yeah, it's very broad in our eyes. So on one hand, it can be used as a optometric or neurological vital. So very similar to, let's say, blood pressure or heart or cholesterol or heart rate. And that can have broad uses for, right now we have optometrists, ophthalmologists, nurses, EMTs, even clinical researchers using it. And then once we do some clinical validation in the concussion space, and we're doing that now with IU Health and Purdue, that we can actually identify the pupil as a specific biomarker for concussion as well. So athletic trainers and sports medicine physicians can use it.
Oh, yeah. So current funding sources right now for you guys?
Yeah, a combination of funding through venture capital as well as angel investors. Some of our VCs are Elevate Ventures, Purdue, as well as Ocean Capital. And the common theme there is they're all believing in the potential for the pupil to improve healthcare delivery.
That's fantastic. And Elevate does such a great job in the state of Indiana.
They're great supporters.
That's really good. What do you see as the growth potential for this?
Well, I think that there are two folds of growth potential. One is expanding the use as a vital, right? So it can be used by many healthcare professionals. So instead of using the pen light, they can actually get a quantitative assessment. And then as we do more clinical research around disease states, we can identify the pupil as a specific biomarker for those disease states if we can validate that. So because the pupil is in the brain, it could be for Alzheimer's, it can be for pain or the opioid crisis, it can be for other cognitive functions.
Gotcha. So the immediate steps ahead this next year?
Yeah, three priorities for us for Brightlamp. One is we want to expand the use across healthcare professionals. Two, we want to continue to improve the reflex technology to meet the needs of those healthcare professionals. And then we want to complete and publish that clinical research we're doing in the concussion space so it can be used as a specific biomarker for concussion.
Very good, very good. Well, as I do on each and every show, I try to give some Dr. K's prescriptions to try to help you out. So I came up with the 3 C's for a new innovation moving into an expanding venture like you guys are doing. So the first one is credibility. I said, use the current app development that you've got to continue your expansion strategy, which I believe you are doing right now, which is great. Second is customers. I said, you've got customers right now, some current ones, which is great, but leverage off those to get additional ones as you make believers, continually down the road. And then the third C is capital. We were just talking about that. And I said, focus on the viable sources like you've been doing, which I think is great, but continue and even think about maybe some strategic partners that have real reputations or experience in the field, which might help as well.
Great.
So I hope those help you as you guys move on now.
Absolutely.
And where can our audience find you, Noel?
We're on the website at brightlamp.org.
Brightlamp.org.
Yes.
Well, there you have it, Gary. A phenomenal breakthrough innovation in the healthcare space that I think is going to help us, I think, in a lot of different areas right here in Indiana.